Hi everyone, my name is Frederick Bugonko. This is my presentation for Nursing 451. My topic of choice here was teaching our patients about discharge medications. The reason why is this important? It says despite acute diagnosis and treatment during hospital stays, and that many patients still have drug therapy problems at time of discharge that may result in readmission. These problems may cause unnecessary expenditures in the already strained healthcare system, and readmissions and visits to emergency departments may cause further strain. The reason I chose this topic was because in the recent past, we've been at our staff meetings, it's been brought to our attention that survey results have been showing dissatisfactions from patients about the instructions they're receiving about their medications. It's estimated that 20% of patients admitted to hospitals require acute care services within 30 days of discharge. Fearson states that medication management is a key part of any care delivery model to reduce or prevent readmissions. The World Health Organization has referred to non-adherence as a worldwide problem of a striking magnitude. And it says that improving adherence to medication has become a priority for healthcare researchers and policymakers. The researchers suggest that 30 to 50% of patients do not take their medication for chronic conditions as prescribed. This is especially true for older adults who may have multiple comorbidities upon discharge from hospitals. And for them, understanding the post-discharge treatment plan may be low, especially if they have limited English proficiency or health literacy. At my unit, it does not have a standardized method of providing discharge education to patients. And like I said, the data scores from the patient surveys showed less satisfaction with medication teaching. And this has been ongoing for a while now. Patient participation in medication management during hospitalization is thought to reduce medication errors. And following discharge, they improve adherence and the therapeutic use of medications. Also, patients who misinterpret their medication regimen, do not comprehend their disease, or have doubts about reasons for taking the prescribed medications are significantly less expected to adhere to their treatment. And these are also the important reasons why it's important for the nurses to get the education about these medications right. The root cause analysis for this topic, I found that the HCAHPS scores here for medication teaching have been routinely low, as reported by the several surveys. And my hospital, like many hospitals, does provide written instructions that's supposed to enable discharged patients and caregiver to refer back to when they are at home. We found that our patients do not have any follow-up, at least post-discharge. But the only follow-up they get is the survey, and that may be a little bit too late. We find that the national inpatient survey found that 3/4 of patients received an explanation that they completely understood, and 38% of them were given a complete explanation of the medication, possible side effects. But overall, about 8% of patients say they were not told about the purpose of the medications. And 9% said they were not told how to take their medications in a way that they could understand. The study also said that 43% of the staff did not tell the patients about medication side effects, to watch for when they're at home. Looking at the scope and stakeholders, the purpose of the nurse usually is to take advantage of the nurse and patient interface during the medication administration activities, which is an opportunity to assess and assist the patient in understanding about the medication management. My plan here, actually, I spoke to some nurses and patients as well to see what the issue was. And mainly what I thought was going to be helpful here is for the nurse to engage the patient and the family member or significant other in an organized and timely manner, and enable for the patient and the family member to be able to digest the information that they're receiving. The family patient's role here pretty much is to be engaged in healthcare and to participate, in medication management, which will result in knowing the purpose and side effects of these medications, their effectiveness, and be able to discuss it with their primary clinicians. The role of the hospital here is to provide materials like discharge medication cards, along with other information packets for the patient to be able to safely store their materials. Going down here. So what is the solution here? You find that I was able to engage and talk to some nurses to find a best way to approach this issue. Being that the problem here was there was no way of properly communicating to the patient. Sometimes the nurses will feel they're rushed. They don't have time to provide all the teaching. So we came up with a way of listing all the important items about education and put that in the chart on the discharge slot. And when the nurse is giving instructions to the patient, they're able to go down the list of discharge instructions that they need to give the patient. This is on top of the medication cards and other instructions that are available for the patient. We found that the benefits of providing medication-related support to the patients during transition from hospital to home are important. These discharge instructions should not only happen upon discharge, but the patient can also receive instructions while they are receiving the medications while the nurse is giving the patient medications. So these are some of the implementations here. Most of them are geared towards the nurse. Like this one for the nurse will assist the patient to identify the medications that have changed while the patient is in the hospital or no longer required on discharge, and also the medications to be continued upon discharge, the new medications that have been prescribed. The nurse will also help the patient by confirming if the patient is understanding of the purpose of each medication, the possible side effects, and when it's necessary to seek medical attention, the intended duration of the therapy. The nurse also should also ask and verify the patient or caregiver to summarize the discharge medication instructions that have been given. Furthermore, the nurse should provide the patient with a medication calendar, which summarizes the name of medication, purpose, dose, frequency, and when the best to take the medication. Nurse will also provide the patient with follow-up information and appointments, laboratory tests if necessary, concerning their medications. Also, the nurse should be able to encourage patient or caregiver to bring the medication list in whenever they visit the healthcare provider or physician. They should encourage them to keep their medication list up to date, carry their medication list with them at all times, and use a community pharmacy to process all the same pharmacy to process all, their medications. Looking at the analysis here, the nurse should be able to performing nurse surveys before the implementation, and after 3 months, should be able to gauge the perception of the new method of teaching medications upon discharge. So we'll be able to perform random patient surveys 3 months after discharge to see how whether they were satisfied with the discharge instructions, especially about the medications. Also, we'll be observing the patients on the floor to see if the discharge process is being carried out, the medication discharge instructions are being carried out the way it was planned. The next step is to review the results from the surveys. And if the results are positive, we should consider ways of fostering the new method. Example, holding a staff seminar or staff meetings or in-patient education for teaching about the discharge medication instructions. If they are negative, we should reevaluate and make the needed adjustments. We should also gather input from the nurses here about the benefits and challenges with the new process. These are my reference, and I thank you so much for your time.